Dipylidium caninum. Dipylidium caninum is a worldwide parasite of dogs and cats that requires a flea intermediate host to develop. Therefore, its range is dependent upon the availability of both flea and vertebrate hosts, as well as the ability to survive outside of the host until ingested by a flea. Its characteristics are proglottids. Average mature size is 12 mm times 3 mm, have two genital pores, one in the middle of each lateral margin. Proglottids may be passed singly or in chains, and occasionally may be seen dangling from the anus. They are pumpkin seed shaped when passed and often resemble rice grain when dried. First, gravid proglottids are passed intact in the feces or emerge from perineal region of either animal or human host. Then, the proglottids disintegrate and release the egg packets. Larvae of a typical flea intermediate host ingest egg packet, oncosphere hatch and develop into cysticercoids. And then, the flea larvae mature into adult fleas which continue to harbor infective cysticercoids. Definitive host is infected by ingesting fleas containing cysticercoids. Cats and dogs can harbor fleas infectious to human. Incidental human transmission by ingestion of infected fleas affect the small intestine in which the large or the adult parasites resides. Disease causes and diagnosis. Although human infection with Dipylidium caninum is not common, neither is in it a rare event. Dipylidium caninum is mildly pathogenic, producing nocturnal irritability, anorexia, weight loss in infected children. Diagnosis is in finding the characteristic proglottids in the feces or in the perineal area. Symptoms and treatment. Most infections are asymptomatic, but sometimes these symptoms may be identified in an infected individual. Mild diarrhea, abdominal colic, anorexia, restlessness, constipation, rectal itching, and the pain due to emerging proglottids through the anal cavity. Treatment for both animals and humans is simple and very effective. A prescription drug called praziquantel is given either orally or by injection. The medication causes the tapeworm to dissolve within the intestine. Prevention and control. The best way to prevent human infection is to treat infected animals with products which aid in killing fleas on the animal. One can also use oral medication prescribed by the veterinarian. Thank you for listening.